Hello friends, welcome to the channel Dewdear Academy. In this video, I am discussing a question paper that is SCT Staff Nurse Examination which is conducted in 2019. Sree Chitra Thirunal Institute for Medical Science and Technology Staff Nurse Examination. This is a part 3 of the question paper discussion. So first question is, what is the total calorie getting from infusion of 1000 ml of 5% dextrose? Options are 200 kilocalorie, 400 kilocalorie, 800 kilocalorie, 1000 kilocalorie. So what is the total calorie getting from infusion of 1000 ml of 5% dextrose? The correct answer is option A, that is 200 kilocalories. Option A is the correct answer, 200 kilocalories. Then question number 32. What is the normal hemoglobin range of a newborn? Options 14 to 18 gram per deciliter, 10 to 14 gram per deciliter, 18 to 20 gram per deciliter, 15 to 25 gram per deciliter. What is the normal hemoglobin range of newborn? The answer is 18 to 20 gram per deciliter. So option C is the correct answer. Normal HB range of newborn is 18 to 20 gram per deciliter. Then question number 33. Which of the following is an isotonic solution? Options are 0.09% NaCl, then option B RL, option C 0.45% NaCl, option D 5% dextrose in 0.9% NaCl. Which of the following is an isotonic solution? So the correct answer is RL. Option B is the correct answer. RL is the isotonic solution among these options. Then question number 34. In order to perform the catheterization, the nurse should place a woman in options: lithotomy position, dorsal recumbent position, Sims position, Trendelenburg position. In order to perform the catheterization, the nurse should place a woman in. So the correct answer is option B, that is dorsal recumbent position. In order to perform the catheterization, the nurse should place the woman in dorsal recumbent position. Then question number 35. Apical pulse can be assessed at options: at second intercostal space in the left midclavicular line, option B between second and third intercostal space in the left midclavicular line, then between 4th and 5th intercostal space in the left midclavicular line, between 5th and 6th intercostal space in left midclavicular line. So which is the site in order to assess the apical pulse? That is the question. So here the correct answer is between 5th and 6th intercostal space in left midclavicular line. So option D is the answer. Option D is the correct answer, between 5th and 6th intercostal space in the left midclavicular line. Then question number 36. What is the most common complication of myocardial infarction? What is the most common complication of myocardial infarction? Options: hypokalemia, dysrhythmias, renal failure, Dressler's syndrome. So here the most common complication of myocardial infarction is dysrhythmias. Dysrhythmias. Option B is the correct answer. Dysrhythmias are the most common complication of myocardial infarction. Then question number 37. What should be monitored for a client receiving warfarin sodium? Options: INR, APTT, bleeding time, sedimentation time. What should be monitored for a client receiving warfarin sodium? So correct answer is option A, INR. International Normalized Ratio, INR, should be monitored for a client receiving warfarin sodium. Then question number 38. What is the side effect of aminophylline in administration? What is the side effect of aminophylline administration? Options are hypertension, hypotension, bradycardia, flushing of skin. So the correct answer is option B, that is hypotension. The side effect of aminophylline administration. Among these options, the correct answer is hypotension. Aminophylline administration has a side effect of hypotension. Then question number 39. What is the comfortable position given for client with emphysema? What is the comfortable position given for client with emphysema? Options are Fowler's position, dorsal recumbent position, supine position, orthopnic position. The comfortable position for client with emphysema. Correct answer is orthopnic position. Option D is the correct answer. Orthopnic position should be given for client with emphysema. Then what is the normal blood urea nitrogen creatinine ratio? What is the normal blood urea nitrogen and creatinine ratio? Options 10:2, 20:2, 20:1, 30:1. The normal blood creatinine ratio is option A, that is 10:2. 10:2 is the correct answer. Then the next question. Prednisolone is usually not used along with. Options are omeprazole, ranitidine, aspirin, Dionil. Prednisolone is usually not used along with. So the correct answer is aspirin. It should not be used along with aspirin. Prednisolone is usually not used along with aspirin. Then question number 42. What is the classical sign of pheochromocytoma? What is the classical sign of pheochromocytoma? Options malignant hyperthermia, malignant hypertension, hypotension, hyperkalemia. Malignant hyperthermia, malignant hypertension, then hypotension and hyperkalemia. So correct answer is malignant hypertension. The classical sign of pheochromocytoma is option B, that is malignant hypertension. Then question number 43. At what time of the prenatal development should the nurse expect the greatest fetal weight gain? At what time of the prenatal development should the nurse expect the greatest fetal weight gain? Options are first trimester, third trimester, second trimester, implantation period. So at what time of the prenatal development the nurse should expect the greatest fetal weight gain? So the correct answer is third trimester. In third trimester there will be the greatest fetal weight gain in the prenatal period. Third trimester, option B is the correct answer. Then question number 44. In which fetal blood vessel is the oxygen content highest? Options are ductus venosus, umbilical artery, pulmonary artery, ductus arteriosus. In which fetal blood vessel is the oxygen content highest? The correct answer is option A, that is ductus arteriosus. Ductus arteriosus is the fetal blood vessel in which there is highest or maximum oxygen content. Then question number 45. When a client's legs are placed in stirrups for birth, both legs should be positioned simultaneously to prevent. Options venous stasis in the legs, pressure on the perineum, excessive pull on the fascia, trauma to uterine ligaments. So here the question is, when the client's legs are placed in stirrups for birth, both legs should be positioned simultaneously. So what is the purpose? What is in order to prevent what? That is the question. So it is in order to prevent, whether to prevent the venous stasis in the legs, or whether to prevent pressure on the perineum, or whether to prevent the excessive pull on the fascia, or prevent trauma to the uterine ligaments. So the correct answer here is, it is to prevent the trauma to uterine ligaments. In order to prevent the trauma to uterine ligaments, option D is the correct answer. The client's legs are placed in stirrups for birth. That is mainly both legs are positioned simultaneously. That is the reason, to prevent the trauma to uterine ligaments. So these are the 15 questions. So the remaining questions will be uploaded in the upcoming videos. So thank you.